I would say I would love for every dental team member to know at least some oral manifestations of myofunctional disorder or poor sleep. I feel like it's our duty as dental providers to screen for those types of things because most providers aren't looking inside their patients' mouths. And we can see these things. We know what to look for. If someone has a super high vaulted palate, if they have a lot of occlusal wear, if they are, having a scalloped tongue, there's lots of things that we can look for that indicate that they could use some additional support to support their health and well-being. And if that's not something in the bandwidth of that individual practice, that's totally fine, but we should at least be recognizing it and referring those cases.
Welcome to another episode of The Irreplaceable Dental Assistant. And as usual, I have a treat for you. My treat is a cold treat. She's coming to us all the way from Nebraska today, -0 degrees. OMG. We're so happy to have Kayla Kate today. Welcome, Kayla.
Hi.
Tell us about you, Kayla. I know a little something. I've been tracking you. I've been listening to you. I've been intrigued by what you've shared, but share with my guests who you are and what you bring to the table.
So my name is Kayla. Like she said, I am a registered dental hygienist and a myofunctional therapist. I did a bachelor's degree at Kansas State University, and then I went on actually for an associate's degree in dental hygiene. So I did it a little bit backwards. I practiced general dentistry for about 6.5, almost 7 years before I started to learn new things, and the trajectory of my career changed a little bit towards myofunctional therapy. So I started my own private practice in myofunctional therapy in April of 2022, and here we are. I have a husband of almost a decade, and I have a 4-year-old son and a 2-year-old daughter. So a little bit about me.
So all we need to know is if you have the white picket fence and the dog.
I do have a dog. And the backyard fence is white.
Okay.
And it's wooden on the side. So I guess kind of.
So we could say you have the perfect family. There you go. Kayla,
it feels like it to me. Yeah, it feels like it to me.
Awesome. Not many people can say that. So consider that really a gift.
Yes, for sure.
Kayla, for some of my guests who may not know, what exactly is myofunctional therapy?
So myofunctional therapy is a modality of treatment similar to physical therapy. It's just very focused on establishing proper oral function in the head and neck region for proper breathing, for a proper oral rest posture, craniofacial growth and development, and proper chewing and swallowing.
Okay. So how does tongue posture affect body posture, Kayla?
Yeah, so a proper tongue posture is with the tongue in light suction against the palate. So we want the tip, the middle, and the base up against the roof of the mouth at all times, aside from speaking and eating. So all the time we want the tongue up there. What that does for us is a number of things. It aids in nasal breathing, which is our body's designed way of breathing. It aids our craniofacial growth and development, and it also provides, overall body stability. We want that tongue to create that anchor in the oral cavity, which kind of helps balance out everything in the rest of the body as well.
Because I'm thinking that if that tongue is not in the roof of the mouth and it rests on the floor, your head tilts forward, and that affects how you walk, how you stand. So it does affect the overall body posture. Thank you for that, Kayla. So I have another question for you, Kayla. What is jaw jutting?
So jaw jutting is actually a compensation for an airway that is maybe not an optimal size, or maybe we're not functioning optimally with our oral function. Typically what we are seeing is the head is either down looking at a computer screen, our head posture is forward due to maybe an inability to breathe through the nose, and we place our lower jaw forward, which is connected to our tongue. So when we move our lower jaw forward, the tongue is moving forward as well and opening up that airway for an easier breath. So a lot of people maybe are doing that for a number of reasons. Their tongue posture is low, their airway didn't grow to an adequate size. There's a number of reasons why we may do that, but it's usually a compensation due to inadequate breathing.
So the body does what it needs to do to get that oxygen, huh?
Yeah, we prioritize the breath. We're not able to live for very long without being able to breathe. So our body does what it needs to do to make breathing happen.
Absolutely. So I have another question for you. What does facial tension have to do with a feeling of fullness in the ear or both ears, Kayla?
Yeah, so with inadequate oral function, we want adequate range of motion, strength in the tongue to be able to complete all of its functions for breathing, for chewing and swallowing, and for speaking. If our tongue is not able to do what it needs to do, we're compensating with, facial muscles in our neck and shoulders, which can create a lot of excess tension when muscles that are not meant for certain jobs are helping to complete those jobs. So with too much tension in our face, we're, sometimes not able to drain our eustachian tubes. It can affect our auditory system. It can lead to a feeling of the fullness in the ears. It also can lead to a lot of ear aches. I've seen tinnitus with facial tension. I've seen a lot of TMJ issues, neck and shoulder tension, a lot of issues that go along with the inadequate oral function.
Mm-hmm. Everything affects everything, right?
Yes, it's all connected together for sure.
All connected. What does chewing food inadequately, dipping the chin to swallow, or having to clear food from your cheeks have to do with improper oral function? Can you elaborate on that for me, Kayla?
Yeah, so I mentioned before, we need adequate oral function to be able to have a proper chewing and swallowing pattern. With inadequate oral function, we likely are not functioning well with our tongue. We maybe don't have adequate range of motion of the tongue. We would want to place food in our mouth, use our tongue to push that food to the side of our mouth, chew on one side. If the food needs continued chewing, if it's like something more stiff like steak, chicken, something like that, we would maybe need to transfer that whole, ball of chewed up food, which is called a bolus, to the other side of the mouth, chew. That food then goes back onto the tongue, and we elevate our tongue in a wave-like motion to propel that food backwards into the throat. If our tongue is not functioning or we don't have range of motion, those functions are maybe too difficult. So sometimes we see the food doesn't get chewed enough because it's too much work to transfer that food back and forth. We maybe see that the food is not getting gathered onto the tongue to propel it backwards. I a lot of times also see that the tongue is not able to elevate in that wave-like motion, so the tongue is coming down and forward instead. That can create a lot of issues with, again, the facial tension. Our mouth is our primary source of digestion, so we use our mouth to mechanically break down food with the chewing. We also have enzymatic food breakdown in the mouth, so we use our saliva to break down carbs and fats in the mouth as well. So if we're not chewing our food enough, we're not mixing enough saliva into our mouth or into our food, that food is having to get a lot more work done in the tummy and the intestines, which can create a lot of issues with digestion and gut health as well.
So would we say that the orofacial myologist would help to gain better tone in those muscles that are needed so that we could function? And well, I don't know, are you speaking to a possible tongue tie when you say the tongue is limited? So we may have to do a combination of things to fix that. Would you agree?
Right. So I always tend to like to start on a patient with the least invasive modality of treatment, which is therapy. So we gain as much strength and function. We can increase some range of motion in the tongue with therapy alone. Once we meet a plateau in therapy, we're really not making any more benefits in range of motion, strength, function, those kinds of things. If we've not met our functional goals for chewing and swallowing, we're not able to maintain an adequate resting position, that would be when we would consider additional interventions such as a tongue tie release. So yes, it's not just one provider that's in these cases. It's usually a handful of providers, an orthodontist, a dentist specializing in tethered oral tissues, the therapist, body workers, if we can get those on board as well. Yeah, it takes a lot of people. So
teamwork makes the dream work.
That's right.
So I'm going to speak about this one thing that has caused divorces, that has caused evictions and breakdown in friendships. Snoring. What causes snoring? And is there anything that we can do about it?
Yeah, so most often snoring is caused due to a disruption in airflow as air passes, through our nose, past our oral cavity and into the lungs. Typically, the disturbance or the vibration is caused by the soft palate or the posterior tongue. When our tongue is not in that adequate resting position, we are, first of all, it's on the floor of the mouth, and we're not holding that soft palate stable with the back of the tongue. Those two tissues, the soft palate and the posterior tongue, need to be in contact to prevent, 1, the collapse of the soft palate, and 2, the sliding of the tongue posterior and down into the airway. So that's when we get the snoring. We get the sleep apnea. If the tongue is completely occluding the airway, air stops. Our body recognizes that we're not getting enough oxygen to the brain. Our blood pressure increases. We have a microarousal. We, gasp for air, resituate ourselves in the bed, go back into that same cycle all night long. And the same can be true for snoring. We're typically not reaching the deeper, more restorative levels of sleep or getting adequate deep restorative sleep if we are snoring, because we, again, are experiencing a decrease in oxygen saturation or just a disturbance in airflow altogether. So what we can do about that is therapy. I always advocate for therapy with snoring or mouth breathing to get that tongue strong enough to maintain airway patency so that the air is flowing past the oral cavity without disruption. The posterior tongue and the soft palate are 2 of the most important muscles of the upper airway. So the stronger we can get them, if we can get them into an adequate resting position, that's going to help us, maintain airway patency, especially at night when we're sleeping.
Well, I tell you, I think that there's a special headline that you can put for your business. Save yourself from divorce. Talk to me.
Yeah. It's actually funny because I do have a number of wives that follow me on social media. It's primarily women that follow my social media accounts. And I have had some wives send their husbands, like, here you go see her. And they do. I'm always excited when they follow through with treatment. They have success in treatment. They're sleeping better. People tend to not know how bad they feel or how bad they're sleeping until it improves. So if your normal is always sleeping terribly waking up feeling unrested in the morning, having headaches when you wake up, tossing and turning all night, having to get up to go to the bathroom in the night. If that's always been your normal, you don't know how much better that can get until you start to see progress.
I always use this scenario. I'll say, if you've come into a room and it smells very bad, after a while, you don't smell it unless you go back outside. You adjust. So our body seemingly works quite well under abnormal circumstances until you realize, oh, that's the standard. So you smell that foul smell in the room and you've gotten accustomed to it and you're functioning. But when you go back outside and you smell fresh air, you're like, what a relief. So I think it's so important to recognize that sometimes the person who is having the issue is unaware, and it's someone who is doing life with them, whether a sibling, a parent, a spouse, who can say, hey, something is not so right here. Let's see what we can do to intervene. Awesome. Right. Good stuff. So
you also don't, sorry to interrupt, you also don't know how terribly you're sleeping because you're asleep, right? So if your partner, your wife, someone that you live with, your child, if you're on a family vacation, this has happened as well. When you're on a family vacation with other family members, you're keeping the whole house up or gasping for air in the night, or they're saying when you wake up, man, it really sounded like you weren't breathing well. Like you wouldn't know that because you're sleeping, right? So having an outsider bring that to your attention or say, hey, I'm really kind of worried about you, that often is something that pushes loved ones towards getting the help that they need or deserve.
Yeah. So quality of life improves significantly for the household if the person who has the airway issues gets it controlled. And people always say sleep. Yeah, I sleep well enough. I don't need to get my, but they forget that the reason why the sleep is interrupted is because the body isn't getting adequate oxygen. And as you've said before, you can survive without food, you can survive without drinking, but you can't survive without oxygen. Right. So it's a double whammy. Inadequate oxygenation of the body, inadequate sleep, and stress for the household and the neighborhood if you snore really loud.
Yeah, and sleep is just important to our health and well-being in general. That's when our body repairs our tissues. That's when we, repair our, broken pathways or all sorts of things that improve our health and well-being. And if we don't get adequate sleep, we typically aren't living to our full potential. So sleep is so important.
I say we are not refreshing, renewing, or reviving.
Yes, for sure.
So Kayla, picking your brain, what is the one thing that you would want every dental team to know?
Yeah, I would say I would love for every dental team member to know at least some oral manifestations of myofunctional disorder or poor sleep. I feel like it's our duty as dental providers to screen for those types of things because most providers aren't looking inside their patients' mouths. And we can see these things. We know what to look for. If someone has a super high vaulted palate, if they have a lot of occlusal wear, if they are, having a scalloped tongue, there's lots of things that we can look for that indicate that they could use some additional support to support their health and well-being. And if that's not something in the bandwidth of that individual practice, that's totally fine, but we should at least be recognizing it and referring those cases.
Again, you don't know what you don't know until you know, because I can tell you I was in dentistry for at least 20 something years before my eyes were open to the oral symptoms, and all of a sudden I saw lingual acid erosion, I saw scallop tongues, I saw high palatal volt, I saw lots of wear and tear from nocturnal and grinding, and suddenly the same mouth that I've been looking in for how many years, seeing it in a totally different light. Yes. So I get that, and I underscore that it's so important for us to at least know what we're looking for. Yeah.
Yes. Yeah, and once you see it, you can't unsee it either.
Exactly. So I always end my podcast by asking my guests if they have a favorite quote that they'd like to share with us. Do you have one, Kayla?
Sure. My favorite quote, or one of my favorite quotes, I suppose, is, "It's never too late to learn something new, and it's also never too late to change your mind." I think it's kind of just what we talked about. I spent, 6.5, 7 years in general dentistry. I thought I was doing a pretty good job, which, I only knew what I knew, but when I learned new things, a lot of the recommendations that I was making to my patients changed, and that's okay. It's good. It's good to learn. Yes.
Kayla, this has been a wonderful conversation. I need to ask you to do me a favor.
Okay.
Will you consider coming back and sharing with us at another time?
Sure.
Okay, listen. This was fantastic. I'm sure that we've said enough that our listeners can listen again and again and pick up something new each time, because we spoke about a lot. The information was dense, but also useful and practical. Thank you, Kayla.
Thank you for having me. It's fun.
Another great session. Myofacial therapist Kayla was cooking today. Listen, we have to remember that position is key. That tongue needs to be exactly where it needs to be for us to be able to swallow properly, for us to be able to breathe properly, but also to have proper body posture. Who would have thought? And we also touched on the fact that inadequate muscle tone can really affect our ability to chew our food properly. And this therapy with the orofacial myologist can strengthen the muscles and improve that. Sometimes it takes a team, so if there are any other factors involved, other team members may need to be involved. Example, if part of the problem is a tongue tie, we may need to bring on someone who can clip that tongue tie for the patient. And which household member would not be grateful if we could get the loudest snorer to stop? We think airway issues affects one person, but it literally affects the whole household. And if they snore loud enough, it could be the whole neighborhood. So let's do what we can to allow our patients to refresh, renew, and revive. As usual, it's a pleasure connecting with you. If you have not yet subscribed, please do so, because life is better when we live, learn, and grow together. See you the next time.